Dr. Park, I understand there are two types of peritoneal dialysis. I'm wondering if you can briefly explain the difference between the two.
So the first type of peritoneal dialysis is called continuous ambulatory peritoneal dialysis, or CAPD. And this is a type that doesn't require any fancy apparatus or any machines. All you require is a bag of dialysate that you're filling your abdomen with, and then an empty dry bag that you can use to get rid of the dialysate that's already in your abdomen. That's called one exchange, when you empty your abdomen of your current dialysate and then you're filling your abdomen with the new dialysate. And generally that's something that takes about maybe half an hour for each exchange. And most patients have to do it approximately 4 to 5 times a day, every 4 to 6 hours, except for the longer period of time during which they're sleeping. And it's easy to travel with because, again, there's no other machines or any other apparatuses you need to carry around other than your fluids of dialysate. APD, or automated peritoneal dialysis, is a special type of peritoneal dialysis that you can do using a machine called cycler. And the cycler literally cycles the exchanges through as you stay hooked up to the machine. And generally, the machine will undergo somewhere between 4 to 6 cycles of dialysate. And this happens over approximately an 8 to 10 hour period. So patients will generally have to stay connected to the cycler for that duration of time, which is why most patients elect to do this in the nighttime when they're sleeping, which is the best time for them to stay connected to the machine the entire time. And it, of course, provides the extra convenience that you don't have to do any exchanges throughout the day. But patients may elect not to travel with their machine and go back to doing their manual exchanges or CAPD during traveling time because it makes it a little bit easier. But those are generally the two options of doing peritoneal dialysis.
Once a patient opts to do peritoneal dialysis, what sorts of training and preparation can they expect?
So once a patient decides that they want to do peritoneal dialysis, then we wait, of course, until indications arise for them to actually start dialysis. And once we start to see these indications that the patients are nearing dialysis requirement, we have the patient go either get a surgically or a bedside place peritoneal dialysis catheter in their abdomen. Depending on their other medical comorbidities, we can decide which one is more appropriate for them. And once they have the peritoneal dialysis catheter, which is a plastic tube that gets placed in their abdomen, we generally like to wait approximately 3 to 4 weeks to ensure that there is good healing of the tube before we start to use it for training. We do tend to bring patients back once a week or so just to flush the catheter and get some blood work done to make sure that there are no acute indications to start them on dialysis any sooner than we had planned. And just to ensure that the catheter is in the right position and it's working well. After about 3 to 4 weeks of healing period, we'll bring the patients in alone or with a caregiver to start training for peritoneal dialysis. And generally, peritoneal dialysis is a very easy therapy for patients to learn. And we don't normally need more than about 3 to 5 days of training time where they learn the steps of doing their dialysis for themselves at home. Once they've completed their 3 to 5 days of training, we go through their medications and make sure that they're on all the right dialysis-related medications. Then we send them on their way home to start doing dialysis at home. And once they're at home, we do monitor them a little bit closely in the first few weeks just to ensure that everything is going okay at home and there's no troubleshooting that is required. And so the nurses, the doctors, the dietitians, all the multidisciplinary teams basically keep a closer eye on them and make sure they're well supported in their first few weeks.
And I understand too, there's new developments happening all the time with respect to research and development to help improve the quality of care for kidney patients. And there's technology out there that's fairly new, I think, called Sharesource. I'm wondering if you might be able to just comment on, how Sharesource might help both patients and doctors.
Thanks, Deb. So as you've mentioned, there's newer developments in peritoneal dialysis all the time to make PD more accessible and easier for patients to learn and continue therapies at home in a more safe fashion. Sharesource is one of the new developments where, as you've mentioned, allows physicians and all teams of the healthcare providers to monitor patients' therapies at home a little bit more closely, and makes it a little bit easier for the patients to keep track of their therapies as well. So traditionally what would happen would be with each day of their dialysis and each of their exchanges, the patients would have a logbook where they would manually keep track of all of their dialysis related numbers, including their blood pressures, their weight, how much dialysate is going in versus coming out, what are their dwell times, and etc. And the technicalities of this are important for us to make sure that they're getting good, proper dialysis each day, and that there are no other troubleshooting things that we need to do to make their dialysis more optimal. Sharesource allows for a lot of these numbers to be recorded automatically by the cycler machine. And anytime the patients are experiencing any alarms or any weird numbers, essentially, and they're not really sure how to troubleshoot at that point, they can contact their primary PD team. And the PD team has access to the Sharesource numbers immediately, and they can go into it online and help them shoot and see where the issues are, which makes it very convenient in terms of communication and monitoring for both the healthcare providers and also for the patients. If there were any dialysis prescriptions that would need to be altered, the also convenient factor with Sharesource and AMIA is that the healthcare provider could go in remotely and change the prescription for the patient as well, as opposed to having to explain the steps to the patient who would then have to go do it themselves. So there are definitely a little bit of increased efficiency and better communication with the healthcare providers and with the patients with this remote monitoring technology.
Thanks for that. I think, one of the things probably that comes up for patients that opt to do dialysis from home is just the fact that they're not in a healthcare setting and maybe sometimes just a bit nervous if something should go wrong. But, with new technology developments, they've got not only their healthcare team surrounding them, but they've got the comfort knowing that somebody can monitor and they've got access to people 24/7, which makes the process a little bit more comfortable, I would assume. Please stay with us. We'll be back shortly with more of our interview with Dr. Park.